So here we are, the second episode of Chronic Briefs. Yes, we made it through the relaunch. Whew! We couldn't have done it without you, loyal viewers and internet trolling bots. I won't mention you by name, but you know who you are. Comrade. You know, we were thinking to ourselves, what can we talk about for our second episode that people with chronic illness deal with on a regular basis? Should we talk about trying a million different medications with no guarantee any will work? Nah, not yet. We're going to save that for Sweeps Week. Okay, so we should talk about the burdens of chronic illness on relationships and how many of them fail, no matter how hard we try. Nah, we need something a little less cheerful than that, I say. So we're going to talk about side effects. Yes, side effects. Now, those of you in the science arena may know them better as co-morbidities. The official definition goes like this. Comorbidities. Noun. Plural. Definition. The simultaneous presence of two chronic diseases or conditions in a patient. These conditions may or may not be related and can affect one another in a number of ways. Yeah, that's just a fancy way of saying when you're sick, you get sicker quicker. It's the quicker sicker-upper. Yeah, when you have a chronic illness, you start collecting side effects faster than a tobacco company collects lawsuits, and they're just about as dangerous. In addition, the side effects play off one another in an unholy attempt to make treating any one symptom without affecting another effectively impossible. Yeah, it's like one of those puzzle games where you have to slide the pieces around, the square ones to make a picture. Except every time you move one piece, it affects the two other pieces beside it. And so you try your best for an hour, but then you end up smashing the thing because who cares about a picture of a stupid puppy anyway? Anywho, the point is, the longer you suffer from chronic illness, the more side effects you collect. And suddenly, you're at a point where you have no choice but to decide which side effects you can treat and which you can live with. Which brings us to my favorite segment of this episode. Yes, it's time. Ladies and gentlemen, boys and girls, and everyone in between of all ages, it's time for America's favorite game show. That's right, Side Effect Swipers! Hi, and welcome to Side Effect Swipers. I'm your host, Jay Hurts-a-lot, that's Jay for joints, and today we're going to play that most favorite game of those with chronic illness, deciding which side effect to treat and which they can live with, or Side Effect Swipers. Our contestant today is Don from Long Island. Don, why don't you tell us a little bit about yourself? Me? It's Dan, and I am from Long Island, and I've had rheumatoid arthritis since I was 9 years old, and the side effects are very painful and disruptive. Oh, I'm sorry, Dan, not Don. We're going to get that corrected right up in the studio so that we can play our game with no hiccups whatsoever. So, Dan, tell us a little bit more about yourself. Do you have any hobbies? It says here you enjoy Star Wars. That's great and not weird at all for a grown man. Why don't you tell us about that? Oh, well, that's pretty much it. I do enjoy Star Wars. It helps me forget about the pain and fatigue of my illness and all the terrible, terrible things I've lost because of this wretched disease. Ha ha, well, aren't you just a little slice of wonderful? Anyway, I think it's time to get the game going. Just to refresh the rules for the audience's sake, in Side Effect Swipers, you get to swipe left or right on side effects that are possible with your illness. The object of the game is to select 3 side effects that you can live with so that the others can be treated. Now, keep in mind, treating them does not mean that the side effects will actually go away. It just means you get to try to treat them. I know, a little bit of a hiccup there. There are no guarantees in Side Effect Swipers is what I'm saying, but what we do have, folks, is a daily super swipe. Yes, a daily super swipe. Now, what that means is that somewhere in our side effects, there is a super side effect, and if our contestant chooses that one to keep, he or she will not only get to deal with that side effect, but it's also guaranteed that side effect will cost our contestant money, a relationship, a job, or even all 3. Yes, we got the best prizes here on Side Effect Swipers. So without many more of my jabbering, let's play the game. Are you ready to play, Dan? Yeah, I guess. I don't really understand what's happening, but okay, sure. Okay, well, that's a ringing endorsement if I've ever heard one, so let's get swiping. Our first side effect of the day is, erectile dysfunction. Oh, wow, we really started out with a bang today. No pun intended. Let's see what he's going to do. Oh, of course, it looks like a swipe left. No surprise there, folks. No youngish man would voluntarily suffer that fate, I'll tell you that. So, let's see what's next. Okay, it looks like, let's see. Oh, fatigue. Fatigue, that's a tough one to live with. Looks like Dan's thinking about it, though. And there he goes. A swipe right. Let's see what he's thinking. Dan, why did you choose fatigue as one of your symptoms to live with? Well, I suppose that fatigue is something that at least I may be able to get a handle on every now and then. And it's not really physical pain, per se. It's just an extreme tiredness and lack of motivation, and if I have to choose one I think I can live with, then that's it, I guess. I mean, there's no real way to treat it anyway, so why not just take it and live with it? You are right about that, sir. There really, really is no way to treat fatigue, something that many doctors don't ever talk about, weirdly. So, we have one more symptom for you to go. So, let's see what you pick for your second one. Up next, let's see. Okay. Oh, what's next? Oh, heart attack. Oh, boy, I just can't see anyone wanting to risk it with this side effects. And it looks like, yes, Dan has swiped left on heart attack. And why not? Who would ever want to deal with that one? Okay, let's see what's next. It looks like neuropathy, folks. Ooh, neuropathy. That's a good one. Okay, for those of you at home who don't know what that is, it's kind of like pins and needles in your extremities due to nerve damage. Annoying for sure, but not necessarily life-threatening. So let's see what Dan does. Oh, I can see he's thinking about it, but yet, he swiped left. Dan, why did you pass on the neuropathy? It seems like something that would be a little bit easier to deal with. Well, I'm a writer by trade, so having my hands now work well due to nerve damage, well, that kind of seems like a no-brainer to pass up. Besides, neuropathy is painful. It's painful, and currently there aren't many, if any, treatments for it. Many people just have to live with it. Well, I'll be dipped. There's just so much to know about chronic illness, nobody can learn it all. Okay, let's see what the next symptom is. Oh, joint replacement surgery. Oh, that's a big one, folks. That's a major procedure. Let's see what he picks. Oh, look at that. He swiped right. It looks like he wants to deal with joint replacement. Let's find out why. Dan, why did you pick joint replacement? Well, I know a few people who have gotten joint replacement, and even though they said the procedure itself was serious and painful and there's a long rehab, once they healed up, the pain was much less than they had before, and most seem to think it was worth it. It's very expensive, though. Very expensive, those joint replacement surgeries. Wait, do I win money for this game show? Haha, Dan, you can win a lot on our wonderful show here, like a copy of our home game, or a lifetime of pain and suffering. We just love to give stuff away here on Side Effect Swipers, except for money. And if you do win, you'll get to play for the rest of your life. So, let's see what you pick for your last symptom. Okay, let's see. Up next, it looks like depression and anxiety. Ooh, both serious mental issues that pretty much go hand in hand with most chronic conditions. But, look at that. It looks like Dan's going to pass on depression and anxiety, and why not? Who wouldn't want to pass on symptoms like that? Okay, what's up next here? This one is a tough one. It's having a hard time dating. Oh, that is tough. As the song goes, everybody needs somebody sometime, and not being able to find someone willing to put up with your illness is something that many of our contestants end up living with. And yes, it looks like Dan is going to choose a hard time dating as his last symptom. And look at that, it's our daily super swipe. That means not only does Dan get to deal with the symptom, he also gets to be broke, without a job, and without a relationship, all because of that one symptom. Oh, Dan, I'm so sorry. I feel like I'm piling on you today. But I gotta ask, why did you choose a hard time dating? Well, to be honest, like most people who are chronically ill, I've realized that most people don't want to take on the burden, or are scared to take on the burden of having to be with someone who has a chronic illness for a number of reasons. And also, when you meet someone initially, everything seems so overwhelming that it's difficult to get them to stick around long enough to get to know you and realize that you are a good person and pretty much close to normal. So I figured since I'd be alone anyway, I might as well just pick this side effect and live with it. What can I say? Well, you can say goodbye. Dan, you have been a wonderful contestant here on Side Effect Swipers, and you will be going home with a copy of our home game, which ensures you will have years of dealing with side effects and their debilitating effects on your life for decades to come. Thanks for tuning in, everyone. I'm your host, Jay Hurts-a-Lot. That's Jay for Joints, telling you to be kind, rewind, keep on keeping on, and we'll see you next time on Chronic Briefs. Thanks for tuning in, folks. Survey says number one answer on the board. 100 people asked. Let's play the feud.